Imagine a world where half of the population is afflicted with a specific condition, yet the doctors, scientists, and researchers know very little about it. Well, to me, this is exactly what happens in menopause. I'm Dr. Heather Hirsch. I am the program director of a menopause clinic where I work and see patients here in Boston, Massachusetts. I started my career always wanting to help women. I was very interested in women's health, but it wasn't until my fellowship training where I realized the biggest gap in care by far is women's health in midlife and at menopause. When I realized how misguided, mistreated, or undertreated women were in their midlife and menopausal transitions, I knew that this is exactly what I wanted to do with my life. I'm a US board certified internist. I actually spent a year or two doing gynecology. So in my practice, I do consultative menopause and in-office procedures where needed. Now, why I think menopause is so interesting and a really fun career is because there is not one size that fits all. And as I tell all my patients, there is not one right or wrong answer for menopause. The goal should be that you feel like you can thrive and that the plan that you choose to help you alleviate any symptoms as they come up along the way should feel awesome for you. A lot of women feel unheard by their doctors. They present to their doctor's office with symptoms or maybe questions, and they don't get very much conversation consulting in return. Now, this frustrating problem really has to do with the lack of education that clinicians get, but what you can control is how to navigate menopause in the way that feels most comfortable for you. I feel as though there's three main ways that we can think about when navigating how best to treat and alleviate menopausal symptoms. The first big bucket is information, validation, over-the-counter options, lifestyle changes, and supplements. So that's what we're going to talk a lot about in this video. The second is non-hormonal FDA-approved options to alleviate menopausal symptoms, and the third is hormone therapy. Now, you may not want to take a medication, you may not qualify for a medication, you may have contraindications, or it just might not be a part of your medical plan. So we're gonna talk about some of the supplements that I find really powerful in the menopausal teas that can help to alleviate a lot of your symptoms. Starting with over-the-counter safe herbals and supplements is an excellent place to start because you never know how really small changes or additives can really alleviate your symptoms. I want to talk about 6 different herbs in this short video that are going to help you to alleviate your symptoms that are in some of the menopausal teas. I always say, as a clinician myself, anytime you have questions about adding something to your regimen, make sure you discuss it with your doctor. The first powerful supplement is ginkgo leaf. It can help improve mood, energy, and memory, all things that can really help if we're experiencing brain fog, fatigue, and just the overall sluggishness that comes along with the midlife transition. Ginkgo helps to neutralize antioxidants and free radicals, and those are kind of like the Pac-Man that goes around and can damage healthy tissues. So to be able to neutralize that is one of the big reasons that it can be so supportive. It can improve circulation, it can help decelerate aging, and reduce inflammation. Of note, do not eat ginkgo seeds because they are poisonous. The next is red clover, and red clover is so helpful to help to alleviate hot flashes and night sweats that come along with the menopause transition. Red clover may even help to slow bone loss, which is great because you want to maintain as much bone density as you can, since bone loss is accelerated by the loss of estrogen that goes along with the menopause transition. It also has some potential benefits on the heart. For example, increasing your HDL, your good cholesterol that you want to be high, and protect against heart disease. There's also a lot of data being done to see if the isoflavones in red clover can help to keep your arteries healthy. Your arteries are the small vessels that help blood flow go up and down and circulate around your heart. Better health of your arteries means improvements in cardiovascular health. Next is licorice root, which can also help to reduce bothersome hot flashes and night sweats. Licorice root has natural flavonoids. These are chemical structures that look a little bit similar to estrogen on those receptors in your brain and in the body that are looking for estrogen as those levels have naturally declined postmenopausally. But it's not estrogen, although because of that similarity in its chemical structure, it can have some estrogen-like effects. It's also a potential antioxidant, which means that it also has some anti-inflammatory and hopefully antimicrobial properties, which is a great added benefit. And also, it's thought to have some benefits on calming down some of the stressed out adrenal glands. So lots of naturopaths recommend licorice root, especially in times of high stress and potentially to help lower those cortisol levels naturally. Next is erythro root, which is also really helpful in reducing hot flashes and night sweats. I keep saying this one, but this one is such a big one and it's so important. It's not exactly a phytoestrogen, but it does have some of those estrogenic effects without being estrogen itself. Erythro root is also a great supplement. It too has estrogenic effects on the body and those receptors that are looking for estrogen, so it can help reduce bothersome hot flashes and night sweats. It's also been widely used as something called an adaptogen, so it can help reduce stress and inflammation and can be widely used to help also with anti-inflammatory and antimicrobial properties and used to treat and help support your body during things like colds and flus. Rooibos is also another herb that can actually help to reduce body fat. Yes, you heard me correctly. It's commonly used in teas and it can again help with that metabolism support and weight management. It contains another property that helps to trigger those hormones that say, I'm hungry. So by dampening those down, it can help to naturally curb cravings and appetite when you're not really hungry. Rooibos teas are gaining a lot of popularity right now, especially when used in conjunction with a healthy, clean, paleo-type diet for weight management. My last and most favorite supplement is black cohosh. I recommend this almost every day. It helps to reduce hot flashes, improve mood, and also maybe to help reduce dryness. There's a large study that also showed that black cohosh supplement caused a 26% reduction in hot flashes and night sweats. That's really good in my book. It is a super common ingredient that may already be in some of your other over-the-counter supplements because it is so commonly used to help reduce bothersome menopausal symptoms. All right, now that you know a little bit more about those 6 really important herbs that are used to help reduce menopausal symptoms, I want to show you the 2 teas that I really, really like. The first is the Menopausal Support Tea in the peach flavor. Oh, I use this at night. It is so wonderful, so calming. And the ingredients in this include ginkgo leaf, licorice root, black cohosh, and a few others. Next is the apple cinnamon Meno Slim Tea. That one has your rooibos, your ginkgo leaf, your black cohosh, and even some matcha. What I also really love about these is you can see quickly on the back the list of ingredients. It's nice and crystal clear, and they taste and smell amazing. Each woman's menopause journey is so individualized and so different according to her medical history and her priorities. I really hope you've landed here on a site where you can find a lot of supportive supplements that are safe, that can be used in conjunction with lifestyle measures to really alleviate a lot of your symptoms and flourish and thrive. As always, be sure to talk with your doctor, and I can't wait to see how you do. If you want to follow along with me, I'm at Hirsch MD across all my social media platforms, and I'd love to hear from you there.